Blood sugar, an introduction. The foods we eat, such as fruits, vegetables, grains, dairy, and legumes, provide what we know as carbohydrates. These carbohydrates are broken down into simple sugar molecules, also known as glucose. This happens in our digestive tract, turning our foods into simple sugars, and as sugar rises, this triggers the pancreas to release insulin, which enables cells to receive glucose for energy, thus removing it from the blood. Glucose is essential for our survival. It gives our body energy and it fuels our brain. The ideal values your doctor looks at for your labs are a hemoglobin A1C below 5.7. This just looks at the average blood sugar levels over the last 3 months. They also look for a fasting value below 100, which measures your current blood sugar level. However, if we eat too much sugar or carbs, it will overload the system, which can lead to the body becoming less sensitive to insulin, or the pancreas will stop producing enough insulin, which then causes elevated blood sugar levels. In addition to unhealthy eating, other factors that your blood sugar could raise are from stress, age, inactivity, sickness, medications, family history, obesity, pregnancy, and smoking. Some risks for having high blood sugar include prediabetes, diabetes type 2 or gestational, high blood pressure, heart disease, vision loss, slow healing wounds, kidney issues, bone or joint problems, weight gain, to name a few. Luckily, there are some simple things that you can do to manage your blood sugar to avoid these risks. First is to have a balanced diet. What does a balanced diet consist of? Half the plate should be non-starchy vegetables, for example, leafy greens, tomatoes, and more. A quarter of the plate should be carbohydrate-rich foods such as rice, sweet potato. The last quarter of the plate should be proteins like meat, eggs, fish. But in general, to maintain a balanced blood sugar level is to allow for about 25% carbs in each meal. Further, let's look at the glycemic index, which ranks the different types of carbs into high versus low. High glycemic foods, which spikes your blood sugar levels, include simple sugars like candy, instant oatmeal, white bread, cereal, white rice, and more. Alternatively, you can choose low glycemic foods, which has slower blood sugar release with complex carbs such as whole fruits, steel-cut oats, whole grain bread, nut butters, brown rice, and more. Let's take a look at this graph. For example, eating foods in the high glycemic category would quickly get converted into glucose. If N represents normal blood sugar level in between meals, then after eating a high glycemic food, your blood sugar level would spike quickly, and soon after the pancreas would release insulin in proportional amount to the sugar being released in the blood to bring it back to a normal level. However, since there is a time lag from when the insulin is released, there is a period of time when the blood sugar is actually lower than it should be, which makes you feel hungry. Conversely, let's look at what happens when you eat a low glycemic food. Your blood sugar would go up more slowly, which also means a proportional amount of insulin would also slowly be released. The blood sugar will go down slowly, unlike a high glycemic situation where your blood sugar would plummet. Instead, your blood sugar would be stable. Choosing a low glycemic food is more ideal. Combining this with protein, fibers, and healthy fats will help slow the release of sugar in your blood and also reduce energy crashes and hunger cravings. Other ways you can manage blood sugar levels include exercising. It is recommended that you do at least 150 minutes of moderate intensity and 2 days of strength conditioning per week. Also, stop smoking and getting at least 7 to 9 hours of sleep can also help your body metabolize glucose more efficiently. Last but not least, managing your stress can help your blood sugar levels. So take a break and meditate or enjoy your favorite relaxing activity.